For the latest on COVID-19, we've since re-established connection with Professor Francois Venter, Divisional Director of Ezintsha at the University of the Witwatersrand, and he joins us now on the line. Professor, warm welcome back. Can you hear me now?
Sorry about the IT trouble.
All right, no worries. So we're just taking us through whether the flattening of the curve will be seen in the next few months or not.
It probably will be, it almost certainly will be seen, but it's peaking very rapidly, and it's particularly in Gauteng, and I suspect KZN is not far behind, as well as the rest of the country, I'm afraid. We were hoping this wasn't going to happen, but it's going to happen. So I think particularly in Gauteng, the next few weeks are going to be grim.
Well, do you think it's fair, Professor, that the health officials and authorities here in South Africa are, so viciously criticized with the way they're handling the rapid rise of infections and the death toll in South Africa, bearing in mind that the winter season, of course, is obviously a season where we expect a high rise of, such cases?
So on the one hand, I think there needs to be some forgiveness. We have not seen anything like this in recent memories, a massive pandemic just hitting us so quickly. So we also only appreciated the science of the transmission in almost real time in the last few weeks. So I think there needs to be some forgiveness in terms of, I watch the politicians blaming each other and, firing up. I think the things that are unforgivable is that our health system doesn't appear to be equipped. We're getting reports of oxygen outages, of patients being turned away from hospitals. We've known this has been coming for 4 months. It's not okay, the fact that the healthcare system is not ready. And at the moment, I think the biggest threat, people keep talking using this lockdown language. The biggest threat we have at the moment is overwhelmingly to our healthcare system. Everything should be thrown into supporting the healthcare system at this stage. Gauteng and KwaZulu-Natal, we've seeded COVID into the communities. It's spreading like wildfire. There's very little that's going to stop its transmission at this point, other than maybe dealing with some of the issues around public transport and trying to deal with crowds and things like that. But at this point, what's coming is a wave of sickness directed directly at the hospitals and the clinics.
Professor, it's safe to say that at this point, the message of coronavirus has filtered down to almost everybody in South Africa, and that almost everyone knows what coronavirus is and just the importance of taking all the necessary precautions. But then we see a rapid increase in the infection rates and a rapid increase in the death toll. What do you think is the root cause of this? Do you think, or rather, do you get a sense that people now suffer from what we call COVID fatigue? I mean, being constantly bombarded with information on a daily basis?
No, I think every single South African at this stage feels like COVID fatigue. In fact, we had so much time to look forward to this, or not look forward to it, but to see this coming. I think we're all just fed up. It's almost, I relate to the fact that sometimes you just want to say, I just want to get it. The problem we have to understand is it's not people like me who are relatively healthy, but it's your granny and grandpa and the diabetics in your household that are going to be at risk going forward. So that when you get it, you've just got to make sure that you do not transmit it onto the people who are going to die in the hospitals.
Let's talk about the model that the government is applying in terms of containing the spread of coronavirus and dealing with this pandemic in its entirety. There are models which are suppressive or mitigative. Where do you think the government stands? I think the model is amazing. They've done a good job in terms of doing the predictions and things. I don't think government has been good at implementing much of what needed to be done. We quickly became aware of the fact that the physical distancing is possibly the single most important thing that we know is the most important thing, followed by masks, followed by the washing of the hands, and then increasingly apparent is trying to get as many people outdoors as possible. What government should have been doing is communicating this through to all the sectors of the society and saying to them, how do we do this most effectively? And I think the one where there's the biggest failure at times is the taxi industry. We could have sat down with the taxi industry and explained why it's so important for people to behave in a certain way in the taxis, to wear masks, to try and let people in the taxis, to open the windows, and try and come up with a plan to take that forward. Instead, what we've occupied ourselves as a country in the last few months is endless litigation, endless debates about stuff that actually isn't that important. When these are the strong debates we should be having with religious leaders, we should have been having with mall owners, we should have been having across the board. And some people have come up to the plate. I've seen lots of changes in the society which will blunt the spread of the virus. But there's a lot of other areas where I just feel like government has really let us down. And speaking of government letting us down, there's a raging debate with regards to the best strategy of lifting the lockdown. Do you think that the government was successful in terms of striking the balance between saving lives and, keeping the economy going for the livelihoods of people?
Frankly, no. I think the first 3 weeks we bought ourselves some time. But beyond that, it's clear that the virus was spreading like wildfire. Even in the extension to lockdown Section 5, it was clear that things were already out of control in the Western Cape. It didn't manage to arrest it there, and it certainly hasn't arrested it in Gauteng and KwaZulu-Natal, and certainly not in the Eastern Cape. So again, I think that, and again, there needs to be some forgiveness with government. This was unprecedented time. But as I said, I don't think we focused on the stuff that was important, which is educating people around why they need to social distance. We've used the language of lockdown to engage in fairly irrational debates, actually, and distracted ourselves from how do we get children back to schools on time and safely. And I do worry that we've brought, the economic impact has been severe in South Africa. And for me, as a doctor working for years in the public service, the impact on other programs like HIV, TB, vaccine programs has been severe. We are going to be mopping up the consequences of this lockdown for years to come. And that worries me a great deal, is that we could have done all of these things. We could have had a rational response to COVID, but at the same time we could have protected the healthcare measures that were out there and protected the vulnerable. And unfortunately, none of this has happened. And now we're sitting here with an unprecedented stress on our healthcare facilities.
Yeah, we'll speak to that, about those plans in just a moment. But then we've seen a couple of days ago Gauteng Premier David Makhura saying that they're actually in consultation with the experts with regards to, the possibility of Gauteng sliding back to level 5. While on the other hand, we've seen KZN Premier Sihle Zikalala saying that they'll not resort to the stricter lockdown measures. But in both provinces, Professor, all the numbers are rising quite alarmingly. So if you were at a position of Premier for these two provinces, what would you do differently?
So I would stop using that lockdown language, firstly, immediately. We need to do the stuff we should have been doing on week 1, which is get the physical distancing as much as in place as possible. We know it's when people congregate indoors that they transmit the virus. We need to tell our people that if you're standing indoors without a mask and you're standing there for more than a little while and you're not opening windows, that is a catastrophe. It's a huge public health knowledge. What I don't want to see is another situation where we start debating alcohol and cigarettes and curfews and things like that. This is a massive social buy-in project that we need to have. And when Makhura talks about going to ask the experts, I want to know who these experts are. Government keeps talking about experts advising it, and I need to know, who are these? Name these experts, because the people I talk to, we know what needs to be done. It's all the stuff that I'm talking about, the non-sexy stuff, which is not about litigation and not about fancy footwork and things. It's about basic social engineering and getting the buy-in of the entire population for a big project that I think everyone was on board with in the first 2 weeks.
Now, in terms of preparing South Africa with regards to, protecting themselves against the coronavirus, earlier on, you've made a point that seems to, place the blame squarely on the government's intentions or the government's, lack of, the fact that the government did not prepare adequately for coronavirus. None of the countries were prepared for coronavirus because it is such a new and novel virus that no one was prepared.
No, I think there's something in that, and as I said, it's unprecedented, the threat that we've had. I do not have much time though for the argument that government did everything it could. If you're running out of oxygen already in Gauteng, if you're already having ambulances that don't know where to take people because the hospitals are full, early on in the epidemic, that suggests basic lack of preparation. We've had almost 4 months of waiting for this in Gauteng. The Western Cape barely coped, and the Western Cape's always had a better health infrastructure than anywhere else in the country. If this is what's happening in Gauteng, which has got somewhere in between, you can understand why the Eastern Cape hospital is just putting one over after the other. Is what were the managers doing? What were the people doing to get this ready? And who it's going to be? Poor people, patients, and it's going to be the healthcare workers who are going to be the brunt of this poor preparedness. So we talk about personal protective equipment. Most of that's still, there's reports of outages. But when you have outages of oxygen, of transfer of sick people to which facility, that is very, very concerning. So that's where I think my patience isn't, I don't have much patience with some of the government responses around this, is that leave it to us. We've got this under control. At the moment, there's very little to suggest that they have this under control.
And what's even more concerning is the rapid rise of infections amongst the healthcare workers. Do you think that this will be out of control?
It is out of control already. We've had reports. I know dozens of doctors and nurses who had it already. And most of them have done fine. You know, we've had some deaths. We've had 2 high-profile deaths in the research and medical community, and I'm sure there's some I haven't heard about yet, and some who are still sick. But again, that social contract with healthcare workers as well is being broken. You know, when you don't provide the PPE, I think the other thing I'm really frustrated with is the sudden local level hospital clinics where between unions and government there's a huge clash of wills and heads. And again, I want to say is what has everyone been doing in the last 4 months while being sitting at home, trying to buy time? If now suddenly all the things that are wrong between management and the unions are being unveiled. And to be fair, I think a lot of the unions, it's simply a matter of fear. You know, if I was working on the front lines as well and not having PPE or not being told good scientific information or getting mixed messages from government, I'd also be scared.
All right, Professor, great chatting to you. Thank you so much for your time.
Thank you so much.